Okay, like I said, I think I can get this done a little bit before our time is up. For anyone who came in late, I'm Terry Bergen. I'm the Mobility Coordinator in Linn County. Want to, I think other speakers have addressed this, but mobility management is trying to find new ways to utilize services that we have in existence to meet needs both locally and regionally, and helping people that have transportation challenges. And primarily that ends up being seniors, persons with disabilities, and people with income challenges, finding transportation that they need. And it's also involving easy information and referral. What does that mean? Well, I was a mobility coordinator here for about 2.5 years, starting back in 2012. When I started, one of the things that we thought we needed to do right away was have a way for people to reach out to me and to get their questions answered or to get help. So we started back then, almost 5 years ago now, 365 Ride information line. It's the number 365-7433. And we tied that in with our website, which is 365ride.org. And I haven't brought samples of those, but you can go online and see the website. And we also developed a transportation resources brochure, which lists all the transportation options in the area. This year, we distributed between 3,000 and 3,500 of those brochures. This year, for the first time, we did a version in Spanish. And so about 500 to 600 of those were Spanish versions of the same brochure, in recognition of the fact that we have more and more people in this area who have Spanish as their first language, and they still have transportation needs. So that's a big part of what we do as mobility coordinators, being there for people who need information, who need help. I get calls from a lot of different people regularly with different requests. These are just some of the things, but rides to medical appointments. And it's everything from, I just had surgery and I can't walk to the city bus, so even though I could afford it, I can't walk there, but I can't afford a taxi, to people who call and don't realize that because they're on Medicaid, that there is a transportation benefit and they don't know who to call. So medical appointments are a big thing that we get calls about. And then whether it's medical or not, again, people that don't have the money to afford the ride that they need. And it could be someone, a ride to work. They may not be on the bus route. If they couldn't afford to take a taxi, there isn't a service. NTS doesn't run during the day, so that's not an option for them. So any number of reasons that people can't afford the rides. We get requests for rides to and from Cedar Rapids from nearby communities. I live in Mount Vernon, I need to get in, whether it's a doctor or whatever. Or I have a friend who's in a nursing home, I want to come visit. How do I get there? And sometimes rides are available, sometimes they aren't. We can check with Lyfts and other providers, but a lot of times the rides they want aren't available for them. Again, I mentioned as a medical condition, if I broke my leg, I can't walk the 3/4 of a mile or half a mile to the bus stop, so I can't use the bus. Work rides, again, off the bus route. We have a lot of people that, whether it be NTS or Cedar Rapids Transit, take their bike along, and then once they get done with their van ride or their bus ride, hop on the bike because they've still got several miles to go or a couple miles to go to get to their job. Some of them are even don't have a bike, can't ride a bike, whatever. And so we get a few calls on that. Still get calls with people wanting or needing rides to Iowa City for medical reasons and other. And this time of year, I get quite a few calls about kids and school rides. We're just inside the limit, but it's too far for my 3rd grader to walk, and I have to go to work at 7:30. What do I do? So there's challenges there, and that's the sort of stuff that I try to keep track of and monitor, so we can then share with the Transportation Advisory Group. Here's what we're hearing. Here's what questions we're getting. Here's the types of rides people are needing. Another thing that we do, presentations, go out and set up a booth at the Stand Down for Veterans and Homeless, be members of a lot of different organizations, so I'm involved in a lot of different groups, so I can be there to be part of the discussion when it's talking about refugee issues or homeless situations and where transportation fits in those. And getting involved in educational events and seminars and conferences. A lot of community outreach. The more, and I think Cheryl mentioned this earlier about, cycles that mobility programs and others go through. I thought a couple of years ago, we were doing really well. We had some good awareness, getting a good number of calls, traffic on the website, and then I left to take a job at another nonprofit and was working there, and the priorities I had weren't necessarily the priorities for the new person. And so the community outreach stuff wasn't quite as much, and some things kind of faded a little bit, and so you got to keep after that regularly. So being involved in this sort of stuff is pretty important. Doing grant requests. That's a big part of mobility management too. You want to find the money to be able to afford to do the things that you want to do to help people. I mentioned the Heritage Area Agency on Aging funding. That was one of the first things I did when I got back into this job in January of this year, was applied for grant funding through Heritage. And they liked the idea that I had, and they said, yeah, we'll fund that. And the concept was that we would take whatever money they could give us, get matching funds from the DOT, and we would have that as a pool of money for all those people that are calling, yeah, I can't afford to get to my doctor. And the options for them might be an Uber ride, it might be a cab, it might be lifts, it could be whatever the least expensive, but the ride that was going to work for them would be. And we would take that money and we would get them to those rides, and it was going to be focused on seniors and persons with disabilities, because that's what Heritage was wanting to support. So we had that all worked out, got the grant. I'm very excited, and then we got snagged by insurance, because Kirkwood and Heritage said, well, who's going to be liable? And we said, well, the individual provider. If a cab company gives a ride, well, no, we need something that says we're additionally insured, and it has to be of a certain level. And so, I can't go to some little cab company, and I particularly can't go to Uber and say, oh, here's what I need. You need to provide me with some indemnification for insurance purposes, or else I can't get my grant. It just didn't work out. So we didn't get that money. We had to give the money back, essentially. But that's kind of the process, writing grants, getting through the rules, making sure that you can do things. I've recently applied for an American Public Transit Association grant in a coalition building process that they have. And the idea that I have there is we want to get more people engaged, and we want to engage more people in different ways in the transportation advisory group process. We have 20, 25, 30 people who are great, dedicated, willing to show up to meetings and help in any way they can, but we don't reach a number of people, Mark or others that utilize various parts of our transit system. We don't reach a lot of seniors. We don't reach people who have different needs and disabilities and things. We need to be doing more to get out and develop our coalition of people in the transportation marketplace and discussion. So that's the idea there. If I get that grant, then we are going to utilize it to do things like have our meetings go outside of their normal location to try to reach out to people, have them at different times of the day, maybe provide food. Maybe I'll get a few more people if I can provide them lunch, or videotape the meeting so that I can then show them online to people who couldn't be there. Provide translation or signing services for people who may have needs like that, but don't come to these meetings because they go, well, they never think about people like me. So that's the next thing we're going to be going after is, cross my fingers, I think we're supposed to find out in September or early October about that. But And if that happens, obviously you will all hear about it. What's ahead? Cheryl had mentioned the healthcare design a grant process that NCMM is doing. I've been having meetings with Kelly from the American Cancer Society and Kelly from Johnson County and Krista and Jeremy from the DOT talking about this. And we've determined that for a variety of reasons, we aren't going to apply for that grant that they're doing. And one of the big reasons is because we don't know if we've completely and clearly identified what the most and truest focus in each of these areas should be about healthcare. Is it, well, we need more rides to appointments for people with chronic conditions? Or should it be emergency transportation for people who are getting, they couldn't plan it, but I fell last night and I need a ride, and Medicaid tells me it's going to be 3 days. Or, what is it that we need to know? We need to gather more information, and then what we're going to do is try to follow a lot of the process and procedures that they have put in place, because we like that, but then we're going to try to take ownership of that on our own. And the other benefit of that is, I think if we would be fortunate enough to have gotten the grant through NCMM, we would be sort of dependent on the support structure that comes with the CTA NCMM staff, and not forced to step up and do it ourselves. And in this case, we would be needing to do it ourselves, and we would then be able to spread it out to other parts of, say if we do one in Cedar Rapids at the beginning of the year, okay, now we know what we're dealing with, let's go to Johnson County. Or now we know what we're doing, let's make it more of a regional look, or things like that. But we'll have taken the responsibility, we'll have the ownership, and we'll try to move forward there. I still want transportation gap funding. I still need to have some way of being able to help the person that calls me and says, I need to get to the doctor and I'm on Medicare, or my situation is this, and I need to get to the store, or I need to whatever, and I say, well, yeah, I can get you right on Lyft, so it'll only cost you $3. Well, I don't have $3. Well, you know what, you can't just keep turning people down for $3. At some point, we're going to keep going after funding like that. Expanded volunteer driving programs. Smaller towns tend to actually have more luck with volunteer programs than bigger cities. I don't know who these people are. I'm not so sure I want to go just volunteer to pick anybody up, and you could be Wayne getting in. I don't know. Just joking, Wayne. But so we need to do some new things to try to encourage and support volunteer driver programs. You get into challenges with insurance, as you mentioned on that. You get challenges about monitoring and who's going to keep track of all those things. We need to look at all those, but I still think we need to look at ways that, and it may end up just being mobility coordinators doing more. Aging Services has a volunteer driver program. Maybe I should be doing more to get them drivers. Or, Martin with the Riders Club has a volunteer driver program. Maybe that's what I should be spending some time on. Not setting up a whole new way to skin the cat, but just figure out, okay, if I can get you twice as many drivers, how many more rides could you provide? That sort of thing. But that's one of the areas. More public-private partnerships, that was mentioned as regard to, whether that ends up being with, Lyfts and Uber, or Lyfts and Lyft, I don't know. But things along those lines. Corridor rides, continue to promote that. I promote that when I can, but again, that's just such a solid program, and the concept is so good. We have to just keep talking that and getting more people aware. Kristen brought up, maybe there's some connection between corridor rides and the refugee population. I'm sure there are some challenges there between insurance and driver's licenses and things, but it's at least something we can explore and try to figure out how corridor rides can be part of the solution. After hours accessible transportation, there is, certainly NTS is after hours, but they have a specific target, and they're not like a cab company. You can't just call them and say, yeah, hey, I got into the airport and it's 9 o'clock. How do I get around this town? And one of the cab companies apparently has a van that it has an accessible capability, but their charge is like any other private provider. It's like $50 to have them show up, and you know, it costs a lot to get a ride on that. So I think we need to look at more after-hours, you know, accessible transportation, and then more regional coordination. You know, I do try to do some work with the other people involved in Brock's ECI Transit Now Corridor Rides group, and I just think we need to, you know, have continued discussions and more meetings so we can be looking at solutions that aren't necessarily, you know, coming forward when we do it one at a time. You know, any one of us is going to say, well, I can't do that, but maybe if we can get together, we can figure out the answer. So those are some of the things that I'm planning on working on, but what do you think we should be working on in the year ahead? As I said, you know, we have one lonely little blue note over there. And so that's the one that's going to get done. Whatever that is, we're doing it. But no, does anybody have ideas, comments, concerns, thoughts they'd like to share? You have your evaluation forms, so you can certainly put any ideas on there. You have my contact information and business cards, so you can always send me a note. But is there anything anybody wants to share with the group? Questions, ideas, anything like that? Okay, just a minute.
Well, we talked about earlier the advisory council, you know, but at the same time, you know, we did where we could share community-based resources, because hand in hand along with that and trying to obtain care is with this Medicare, Medicaid privatization. Mm-hmm. A lot of case management functions took place, so we couldn't get the services, you know, coordinated. And I just ran into a situation where I had a reaction to a colonoscopy prep med, and it was disastrous, and I had to go by ambulance to the hospital, and they still have a $300 copay. I mean, which is outrageous. Mm-hmm. So we need to, you know, get something done so that our healthcare doesn't get out of range as well.
Sure.
And the copays and everything.
Yeah. Well, you know, that's one of those things that related to healthcare. No one knows how that marketplace and that dynamic is going to change in the next 6 months, a year, 2 years. You know, what might happen and what might be, you know, my biggest concern is, again, people not being able to get rides through Medicaid. Because I get so many people that call and say, and I say, are you on Medicaid? Well, yeah. Oh, I didn't know I could get a ride. And even once they know, you know, if that benefit went away, how, you know, what would all those people do? And so, yeah, there are a lot of issues like that for us to be concerned about. Anybody else? Oh. You were so quiet, I could barely hear you.
You were talking about, and a woman over there was talking about volunteer transportation, and I think there's two issues that come up a lot, which is attracting and retaining volunteers, and then the insurance aspects. And there are resources at the National Volunteer Transportation Center. They also did a nice report recently on how to retain and attract volunteers, and I know they do work on the liability issues, so they're good resources.
Yeah, great. Thank you. I'm sorry, yes? Robin has a question or a comment? I saw you raise your hand and I thought, did I break the lens? That's entirely possible.
Thank you, Jerry. One of the things I'm wondering about is emergency transportation. I believe our ambulance services in the area are privately owned, and I wonder if it wouldn't be a good idea to have them be a public utility rather than a private endeavor. I just talked to Tom over here, and he reminded me that Blue Cross Blue Shield really don't help out with ambulance service like that, so people kind of get stuck pretty hard. So what would be involved in taking that from private to public?
I'm pretty old, but it seems to me, didn't it used to be public? And then it went this way? I mean, it used to be that the ambulances were like, it's Cedar Rapids Ambulance or Eastern Iowa, whatever. It was owned by either a government or a combination of governments, and they moved this way for a variety of purposes like, hey, we're not ambulance providers. We're adding on that service, trying to make it fit into our normal scope of services. But so I think it might be tough for them to go back in certain cases. And I don't know, to be honest with you, I don't know the way it is in every market around here. There could be some that are still not private. Sure. So every area and every town is a little bit different. I think, the other aspect of it, though, is to think about it and engage the people in those organizations about, okay, well, how can we make you part of the solution for some of these challenges that we're having? I know that there are times when you're busy and you can't predict when you're going to be busy, but how many hours a week do your people sit around? And so what can we do? Is there some way to say, well, maybe you can assist in some other way as part of the solution here, but I think engaging them first and seeing what they have to offer in what we're trying to do. And then also I think we'll have to talk to various government entities just to see if that's of interest to them. It's that whole question, whose responsibility? I mean, certainly they receive a contract from the city to provide these services, but does the city want to be in the ambulance business? And that's a tough one. And I think, we have a city councilman here, I'm not going to put him on the spot, but, those sort of things get looked at with virtually every city department. Hey, we don't need to be in the forestry department, we'll hire that out. We don't need to be in this department, we can hire that out. It's that fine line of how far do you go and what really is the minimum expectation and responsibility of the city versus outsourcing. So, okay. So no one can leave until you've all filled out your evaluation. No, if you would, great. If I don't get one from you, I will keep calling until, I will send it out electronically or something. But thank you all very much for being here. I appreciate your time. Those of you who stuck through the end, it shows great fortitude, if nothing else. I don't know, you're probably missing out on a nice day, so go out there and enjoy. Thanks for your time. Let me know if you want to be involved in either our transportation advisory group or anything else that we're doing. I really value your time and your opinion. Thank you.